Today I want to talk about another critical issue that faces our community, and that's health care and the lack of it being available to all of our citizens. We have a population that, because they don't have health insurance, is unable to be able to access health care unless they have an emergency or a crisis. So it's important that we be able to provide this in some fashion. Over the last few years, we've been identified as an underserved area, which means there's not adequate health care provision available to those who don't have health insurance. We've got wonderful doctors and nurses and hospital and clinics, but it doesn't support those who have no insurance at all, who have issues that need constant care, heart conditions and cancer and various other things. We find that a lot of these people go to the emergency room because they have a crisis, but there's no way for them to have follow-up care with a providing physician because they don't have insurance, and they don't go back to the emergency room for follow-up care. You only go when there's a critical need. For the last 5 years, we've been working with Virginia Primary Care because they had identified us as an underserved area, and we've been able to put together a coalition in Franklin of a variety of services and people who are interested in providing health care for all. Social services, Western Tidewater Mental Health, the Obacy Foundation, the charities, the city, the county, Smart Beginnings, and others have come together to find out what the need is, identify it, and then try to find a solution. We've been able to enlist the interest of the Peninsula Healthcare Group that has 8 clinics already all throughout Tidewater. And they're very excited about coming to Franklin and help us have a clinic under their umbrella. We don't have to reinvent the wheel. We don't have to have our own board of governors. We have to do nothing in the world but invite them to come and to open and manage a clinic for us. It's all with federal grants and charitable grants. There will be no out-of-pocket cost to the city. The hospital is very interested in cooperating with us and helping this happen. So we're looking forward to being able to provide much better care. Smart Beginnings is interested because we understand that children need to be healthy when they go to school, with having immunizations, being able to be healthy when they arrive without any particular problems. And in order to do that, we've even gone out with a grant from the Obacy Foundation to have these children enrolled in FAMOUS, so they can have these programs and insurances available for those that are not insured. This will add to the quality of life, and we'll be able to turn around what we call turn the curve on poor health and allow them to enjoy better health because we can provide the necessary attention that they deserve.